largest payer, is saying, we're gonna incentivize clinicians across the country to start implementing whole person care, lifestyle medicine interventions to help their patients. They're going to incentivize companies like Nudge to work with those providers to really amplify their care. So we are at a transformational time. I mean, we're weeks into it. I think 2026 is going to be a time when that's going to happen. I think this is the year that's going to happen. That's the grand experiment that CMS is putting out there now. And we want to show that that can work. But that's kind of what CMS is saying. Let's get them now. We don't have time. The numbers are too big. The costs are too great, right? The impact of not touching and reaching folks is too immense, right? The opportunity cost is too big.
We're entering an exciting time in healthcare. And if that surprises you to hear me say that, by the end of today's conversation, I think you'll have some idea of why I feel that way. In 2024, total U.S. spend in healthcare was $1.9 trillion. 84% of that goes to the centers of Medicare and Medicaid. We're getting older, we're getting sicker, and if there's one thing we can all agree on, we're not getting good value. In December 2025, CMS announced new funding for a new program to begin to support lifestyle medicine. That doesn't mean we're suddenly going to start to train all the doctors, because honestly, that would be 20 years before we'll see the impact of that. But thankfully, there are already thousands of accredited lifestyle medicine professionals. So the question is, how do we leverage those people? Enter my guest today, Yuri Sudhakar, CEO of Nudj Health. Yuri leads one of the few companies already positioned to support the medical system. I met Yuri a few weeks ago at a medical conference and decided we should finish the conversation together with you. Whether you're a provider of healthcare or you're a recipient of it, you're going to find this conversation both enlightening and hopeful. I'm Scott Fulton, professor of Healthspan and Aging. Good to be with you today. Now let's get on with the show. Welcome to the program, Yuri Sudhakar. Great to have you today.
Good to see you, Scott. How you doing?
I'm going to get better because you're going to talk to me again. You're going to finish the conversation you and I started, I guess, 3 weeks ago or so at a medical conference in Dallas. So let's kind of maybe give that context so we kind of give people a framework of kind of the world that you live in and that I get to play in as well.
Yeah, I guess I would say this is, we're talking about such an innovative time in healthcare, although it would seem like it would be so intuitive what we talked about in Dallas. But in Dallas, it was the annual conference of the American College of Lifestyle Medicine, which is really all the, clinicians and health systems that are focused on this specific specialty, lifestyle medicine. And that is, how to actually integrate real evidence-based interventions around stress management, exercise, nutrition, sleep, staying connected, with your group and your social support, and then managing against, behavioral risks like smoking and alcohol abuse. So, these 6 interconnected evidence-based interventions are applied by all these pioneers, physicians, clinicians, health systems, delivering that with their patients, and they get incredible, results and outcomes. And this community and this medical college has been doing it for years. And I think they are one of the fastest growing medical colleges in the country. So that's why we were there. And it was an exciting time to see all of those experts convene.
Yeah, it is the fastest growing, especially in medicine. And you and I kind of get to be the guys who get to play in their sandbox a little bit,
Yeah.
in a different way. Where they're practicing it every day. So if folks are thinking we're going to start lecturing you about what to do around those things, are going to be disappointed at, because I think we've got something far more interesting to talk about.
Yeah, for sure. I mean, look, there's a lot of evidence base around all that stuff, but our, the personal takes on what to do. We'll leave that for the experts to talk about it.
Right, right. So, but it does kind of get at, I think, what everyone talks about. We throw this word around of evidence around, right? And it's a convenient word. It's kind of like, yeah, I read a study and the study said something. And so maybe we can kind of key in a little bit on evidence and where I want to use it is as you described to me what your work is, you described, I think the term you said was really the wraparound technology that essentially fills a lot of the gaps um, that that people may or may not realize that are there. And it really, I think, it explains a whole lot of the inefficiencies we have around both the financial and the health outcomes that we would all like to see better.
Yeah, I mean, I think just I always start talking at a macro level, then I like to drill down into the micro level. But at a macro level, we're nearing $5 trillion of healthcare spend, about $15,000 per capita. Interestingly enough, 90% of that spend is on both the chronic disease, so heart disease, diabetes, and the behavioral health comorbidities, so mental health like anxiety and stress and depression. And the real issue is patients are navigating through the healthcare system, whether they're going to the hospital or going up for a physician visit, and everything is so compressed, right? So the physicians have or the clinicians have 15 to 20 minutes of time with their patient, and oftentimes they're dealing with a range of stuff, and all these what I call the risk factors for chronic diseases are maybe being addressed in that 15 minutes, but most of the time not because you don't have a lot of time. And the patients then leave and they're off on their own. And you've got what I call the in-between time, right? What happens between that next visit or that ER visit, that urgent care visit, that's driving the worsening of the disease or the improvement of the disease. And so that's what we're focused on is that providing those wraparound services, team members, technology, devices, uh, content, right? That can extend the care of the clinician who the patient trusts and really work with the patient as that extension to give them a game plan, right? Or a team and a game plan on how to execute on their health.
Right. As you're talking there, I was thinking, we think coming up through the healthcare system earlier in life, we go in for a specific issue. It might be, I've got a cyst, I've got, a rash or something that's fairly specific. It's some acute condition, and that's much easier normally for a physician to deal with because it's fairly isolated. They know, okay, needs an antibiotic or needs something, and it's got a cause, and we've got some way of treating it. What I think people fail to understand is all that goes into chronic disease because it's typically decades in its development, with or without lifestyle factors. Genetic factors kick in as well that you may not have control over. But there's a lot of things we can do, but it all hinges on kind of going back to what's the evidence we're basing it on. Like there's only so much you can get out of a 10-minute discussion, particularly if the patient isn't fully up to speed and prepared to give the doctor or whoever is the clinician a whole long list of really critical information. That's one thing I try to coach my students and I talk about is this physician-patient partnership. Because you show up, that's what I'm trying to fill in is things that you're doing is what information can you give them to make the best decisions and the best information available so that they can get you on the path to somewhere better. So I'll kind of maybe just preface it a little bit when we get into some of the details I want to get some better handle on. But if people are maybe familiar with remote patient monitoring, right, I'll kind of use that as kind of the early days of we started to talk about that. So maybe why don't you talk about what remote patient monitoring is? That's kind of like I'm sure what you're picking up and taking now light years forward.
Yeah, it's funny you bring up remote patient monitoring because I myself went through what you're just talking about. So much of the healthcare system is about treating that acute issue, reacting to whatever that acute issue is with the patient. But remote patient monitoring is a great example of what other issues that we're trying to deal with, right? So personally, I had hypertension, and that's something very silent that happens in the background that over years to can have massive impact on my not just my health span, but my lifespan, right? I mean, that's 50% of Americans have hypertension. I think
Right.
that's a
High blood
statistic.
pressure, in case
Yeah.
that doesn't mean
High blood pressure,
risk.
high
Yeah.
blood pressure. I had high blood pressure, and it's a silent thing. It's happening in the background. The what I do during my week, how I eat, how I sleep, how stressed I am, right? Am I feeling lonely or detached from society? All those things have actually the evidence shows drives my high blood pressure, right? And so our remote patient monitoring is a great example of how then a technology can come in and say, okay, for all the things that are not that acute, like I got a cut or I need to go get some meds, but specifically, how do I, in a longitudinal way, help that patient, in this case me, treat that blood pressure, right? And so you're talking about the early advent of remote monitoring that exists, right? There are connected devices that allow patients to monitor their blood pressure and then transmit that to their physician, and their physicians now can see what's going on with their patient's blood pressure and then work in a partnership to navigate that, right, with the patient. So that's and even prior to the blood pressure monitoring, I part of the company, a company prior to Nudge that we co-founded was focused on the remote monitoring of cardiac devices like pacemakers and defibrillators, where they output this information and you can work with the patient and the physician to monitor that. So RPM you're right, is a great example of how it's not just about the time that you're in with the physician, but something's happening to a patient's condition um, after they leave, and that's a great technology of how you can help bring that and hopefully reconcile that for the patient.
Well, you hit on what's a perfect example, and I don't talk about it too much. For a number of years, when I would go in and I might get a high blood pressure reading, I almost always had high blood pressure, but they looked at me and said, "Oh, you're a triathlete, you're doing all this stuff. It's just
Yeah.
white coat syndrome. It's kind of showing up here." And it wasn't until I actually started to, I got my own blood pressure cuff and started to do it frequently and said, no, it's actually, it wasn't sky high, but like higher than it should be. And so it's probably 20 years that I probably walked around with some level of, the number was higher in terms of what we would treat back then. But nevertheless, it's kind of, unless you're doing something in between, it's like all or nothing when you show up. Like it's going all in at the poker
It's
table.
scary. Honestly, I was very scared, Scott. I personally thought I had everything figured out.
Yeah,
And then I had this, hypertension. And you're right. At first, I'm like, oh, yeah, that's just at the doctor's office. Then you start monitoring it and you're going, okay, that's a problem, right? It's
right.
consistently showing. The other thing, I don't know what you did, but when I was trying to figure out, okay, why am I having this? What's going on? And the classic, one of the biggest drivers is, salt intake. We know that's a big driver
Right.
for high blood
Yeah.
pressure. But
For people who
for
travel
me,
a lot and can't control their diet, they're going to get a
right,
lot of salt with the restaurants.
for some reason for me, the actual factor where I started tracking this, what drove my blood pressure, I would track. I mean, I was tracking it because I had a company that was building it. Um, Whenever I slept less than 6 hours, my blood pressure would be 10 points higher.
Yeah.
Whenever I had more than 6.5 hours of sleep, my blood pressure would get lower in the range. So, you know, what is the root cause for that underlying chronic condition that I had also is multifactorial, right? It probably was a combination of the salt, but when I was stressed and not sleeping, it just shot everything into, the wrong range for me.
Yeah, we get these compounding effects, right? When you say multifactorial, you'd like to say it's just one thing, and while you could take one pill, that's kind of you know, it's the last resort in terms of on the sequence of things. What else can you do that wouldn't require? Because that would be an example of if nothing else changes, you're signing up for something for the rest of your life.
Yep.
And have you explored the options first, and how do you go about exploring which knobs to turn?
The other thing that you mentioned is the other really cool thing, though, and the ACLM, this College of Lifestyle Medicine, and all these, really amazing clinicians that practice lifestyle medicine will teach you is that, 80% of all our chronic conditions are actually due to the lifestyle choices we make. You mentioned genetics. That has a factor, but so much of our chronic
Yep.
disease is generated from the lifestyle choices we make over time, right? But what's really cool is in addition, if you apply the right lifestyle interventions, 80% of those chronic conditions can be treated, prevented, and potentially actually the disease could be moved into remission, right? So if you have
Right.
diabetes, you can move into remission. So that's what's really exciting. We're at the forefront of not just monitoring with a device, but then how do you apply these interventions in a way to just bring down the chronic disease burden?
So that really says we need more information than just those spot checks, and we probably need more than just monitoring blood pressure, right? Because we're still only in one domain when we're doing it. And I would say it's kind of, if there's nothing I've learned, and it's the habit we all have, we're looking for the binary explanation, binary decisions, and nothing in biology is binary. It's all, you got to have multiple inputs going into it. So what sort of things are going into monitoring kind of the lights, or I guess not so much, well, maybe it's the behaviors piece, but also the result of the behaviors. What sort of things are we monitoring these days? Because I think you've probably got more reach into that than anybody I know.
Well, first I'll say is I go back to the 15 to 20 minutes with our clinicians, right? They are dealing with a lot, right? They've got a
Yep.
lot of administrative burden, documentation, a lot of patients that need to see them, a huge demand on their time. Let's just be very clear. That is the a key point in all of this healthcare conversation. You know,
I've never seen a physician sitting around having a coffee with the boys around the
they're
coffee
the
maker.
they're
That's not life in anybody's office.
no, and they're true heroes, right? I mean,
Yeah.
I know we're talking about there's a lot of sort of factors around the discussion about, physicians and healthcare and all that, but they're really the heroes. And so I heard one, I was actually at the ACLM and someone said to me, I forget who it was, but it was a lifestyle medicine physician that said, instead of me asking, what's the matter with you, which is the classic way of addressing the patient, they've turned it into what matters to you.
Right.
Right. Okay. So the reason I bring that up is if we use that as a jumping off point to what matters to the patient and they start engaging in that, then you're going to uncover a lot of the things that are going on in their life, right? Some kind of trauma, maybe they lost a loved one, loss of a job, trying to reconcile some kind of mental health challenge, right? Um, all the things that go on in a person's life. And so you ask, like, what are those other things? So what we're really trying to do is work with the patient across those six lifestyle areas, those areas that actually, can are risk factors for their health. So obviously, the one of the biggest things is their emotional well-being, their mental health. Where are they, right, on their health journey, and where are they in life? And why do they want a change if they want to change at all? Many patients maybe don't want to change, right? So I think part of the tools and techniques is getting into their why on well, first of all, what do they want? Do they want a better life? I want to be able to live a healthy life, see my grandchildren, you know, run on the street healthy, wake up in the morning without pain, all these things that you've probably see in the world you're in. And then it's about applying, giving them the playbook, right? Around this is how we get your nutrition in order. This is how we start moving a little bit more. Let's talk about sleep quality and how to work on that. Actually addressing, their anxiety and potentially their depression. Are they lonely? Are they feeling disconnected? And working, what we do is we bring a whole care team and we snap that team in as an extension of their clinic, of their physician or their clinician, who the people they trust the most. And from that trust handoff, right? It's almost like handing off the baton. We pick it up and work with that patient on those lifestyle areas. And what we also do that's extremely important is we work with the patient and we try to baseline where they are, right? So we're baselining and assessing where they are and working with them to actually make improvements, whether they're reductions like weight loss and mental health scores, or they're improvements, right? Like sit to stand time and more movement and exercise, right? So that's those are the interventions we bring into play, and what ends up happening in a very quick manner, to the tune of 16 to 32 weeks, you see patients improving, their mental health scores are improving, their cardiometabolic makeup is improving, their movement is improving, how connected they feel, um, where they measure well-being and purpose are all improving. And that's what's really exciting about this, what I call innovation.
You hit on a bunch of things there, but the one I want to come back to, because I really think it's good for whether it's a medical professional or a patient, is where are you? I put this in a comment a couple of days ago, and it really kind of stayed with me. It wasn't by design, but if you don't know where you are, how can you possibly know where you're going? And that question has been coming to me more because of the latest book I'm doing, but it's really a huge gap, and it kind of goes back to like a doctor can only get so much out of that visit that you have with them. But reality is, like I'll use a football analogy, not that I'm any football expert, but it's a good linear game. You go from wherever
I,
you're
lo- I,
on
lo-
end
I
of the,
love the sports
to,
analogies.
to the other end, right? Is that we like to talk about where do you want to go? Well, I want to score a touchdown, right? Okay, that's obvious. Where are you right now? Well, I think I'm, wherever. But reality is it's a very subjective measure that they're using based on some very confusing um, markers that they're referring to, and they could be misleading. And so, versus if you know that you're on the 5 yard line and you think that you're on the 50-yard line because you tend to underestimate where you really are. You're self-critical, or maybe the other way. You say, I think I'm on the 5 line. It's like, I'm sorry, you're on your own 5 line, not on the other team's 5 yard line. It's such a huge part of figuring out where to go, and it's that reality check that I think it helps everybody.
Scott, I think actually you bring up a really important point. I think McKinsey, I think 7 years ago, did a study and surveyed people who had a rate or healthy to moderately healthy to have some chronic conditions to have a lot of polychronic. And what the survey revealed was that many of the people who were polychronic actually their impression or view of their health was a lot better than where they actually were, right? And that's the goal line analogy that they think they're sitting on the five, right? And they're really back at the 20
Yeah.
on the other side of the field. And part of this is building awareness, building literacy, and then meeting the patients where they are to really say, hey, here's some risk factors, but guess what? We're going to work together to figure it out. And that's what we do. I'll even say one other thing is what you see, and there's, what we saw in our own data, not only were these health outcomes improving, right, with these interventions and using things like RPM to monitor the blood pressure and weight, is that in one of our deployments with a big health system, what it showed was actually when you start treating patients this way, their the actual numbers or utilization of hitting the acute care system went down dramatically, right? So that's an important factor in the sort of the economic discussion that we're having about this.
Yeah, I'll kind of it might sound like a tangent, but I was looking at some data just a couple of days ago around survival outcomes of prostate cancer patients versus non-prostate cancer patients. And interestingly, who has the higher 5 and 10 year survival rates? It's the prostate cancer patient because they're more engaged in the system. They
Hmm.
have more, they're involved, they're getting more information than
That's
those who are just
fascinating.
kind of merrily going along, right? Does that not seem absolutely counterintuitive, right? You kind of think, you're done, but that's the difference of being engaged. When I say engage in terms, there's a frequency to the back and forth. What you're talking about though is, and what I teach is really it's more engagement than that, and much more empowerment for the patient when they start to get the feedback.
I started thinking about that. Actually, what you bring up is that when people are confronted with an actual, in this case, life or death situation, or it could be a patient going who just had cardiac rehab, cardiac procedure and went through rehab. They're much more invested in, working on their health now that they know they've had
Right.
an issue, right? This is sort of the secondary prevention model that we're talking about. Um, but I go back to I go back to this the analogy around education, right? We built a system to try to educate people very early on how to read and write, right? So that we can go do productive things in society later on. But in healthcare, I was really thinking about that. I was talking to someone. There is no primary school for healthcare. We just wake up, we go to elementary school, and then we go to all the things we need to do to our basic educational skill, but primary health literacy doesn't happen in a standardized way. So then what's happening is then many of us, me, and it sounds like you included, we're not attuned to what's actually going on, that it's not just the cut or the pain that we have in our shoulder, but it's the silent killer that's pumping away in our arteries that we didn't have any idea about for 30 or 40 years. That's a systemic problem that we need to figure out.
Right. Yeah. I mean, things don't happen fast in medicine. We kind of talk about a 20-year cycle. I think some things these days on the tech side are are probably compressing that time. And that's the 20 years from the time we knew that something would work until it actually was adapted on a broad scale. If I think about kind of what do I want to know, clearly this is a lot of information. How do you gather information when you say the handoff and things? You must have a lot of technology behind you to synthesize the information and be able to make decisions and have discussions on what steps to think about next.
Yeah, I would say, first of all, we think about this about the human experience, that this is still a human experience when that patient meets the person they trust, who's the caretaker for their care to some extent, the clinical team. That's a human experience, and then we still want to deliver a human experience, but surrounding that, the surround sound around that patient and our teams is that technology, right? Where we're able to engage with them, make sure they have all the right literature and information at their fingertips, technology, to make sure that all the things that we're capturing when we meet a patient and are doing an assessment of their health and their wellness, we're capturing that in the technology. Why? Because we want to be able to longitudinally measure and track progress, or if someone's falling backwards. And then being able to now connect that with those data points with devices that can transmit what's going on with their blood pressure or their weight or their respiratory rate, right? And get those in and bring all of those data points, and then their lab scores, for example, right? So what their lab scores say. So bringing all those data points together and then being able to use that to continue to develop a care plan and a strategy with the patient so that they can get to the measurements. And the beauty of that then is now we have a view of not only that patient, but we have a population health view of all the patients that we're working with. Generally, where are they in their journey, and being able to see that in real time. So that is where we complement technology and the human experience that we believe is the kind of a central solution to dealing with the chronic disease situation.
So it sounds like as a result, far more touch points than what it is without that system, right? By traditional methods, the touch point might be once a year for an annual physical, and maybe once a year for some other event, depending on where you are in life, right?
Well, not only more touch points, right? And then so some of it is perception and some of it is reality, right? Perception is now that they're in this program, wow, my physician really wanted me in this program. That's amazing. Like that's a touch point. And even after that touch point, they feel that way. Two, the touch point with the team, right? These are iterative through the month connections. The third, and I think the most important touch point, the AARP just came out with a study that they did a survey that the feeling of loneliness in this country is even at a younger age, 45-year-olds and above are feeling more and more lonely and disconnected. So the third touch point is actually with their peers, which I feel like that's the most important thing of all is that there are other people going through this journey with them that they get to connect with. And that is honestly, that is the most powerful part of this delivery is that it's a mixture of those things, right? The trust, the the clinical team with the expertise to help deliver those interventions, and then others like you who are standing up, falling down, going through the journey together. That is the compelling part of what we're doing. And of course, blending and bringing all the technology and all the data and making sure that it is kind of precision into what each patient is dealing with.
Yeah, and I think that uh, I would imagine people are starting to maybe become familiar with precision medicine and precision health. I've been talking about it for a number of years, but I think you probably speak to it really well, just how you explain it. And we're really trying, and I think that's what a lot of us in, I would say, in any field of medicine is dealing with right now is this, I'll call it the social media pressure of I've got the solution for everybody. Everybody needs more protein. Everybody needs, lower cholesterol. Everybody needs the same thing. Like I guarantee you're right. And I guarantee you're wrong,
Yeah,
right? It just depends who we're talking about.
I'm not a clinician, and so I don't speak to, the knowledge that they have medically for their patients are, that's the key. I just told you that is the key that we amplify that. But I'll go back to my own personal example. I told you it was sleep that I saw driving, my issues as
Right.
opposed to maybe other factors. So yeah, I think it's multifactorial. But we know that both the macro environment and the micro environment you're living in really affects your condition. And getting our hands around that as a country is is the call to action because what we know and what the data shows that if you can do that in a primary prevention or a much more sustained secondary prevention way, I think Deloitte came out with an analysis of 59 million patient records, actuarial analysis that showed if you can apply preventative measures, you can, take that $15,000 per capita cost and cut off about $7,000 of it, right? So that's a big number.
Yeah. So that beautiful setup, because that led right to where I wanted to go was, well, Yuri, this all sounds nice, but if I'm a physician or clinician, I can't afford yet another bolt-on cost, right? So so ultimately, yeah, wrote a note to somebody else around. This was a Canadian healthcare, which it has some different priorities. But it kind of goes back to maybe just kind of step back 1 second and remind everybody and ourselves that healthcare was not designed ever to be preventive. Healthcare was a reactive service by design. So everything we're talking about these days is how do we introduce a new aspect of healthcare that has never been part of their mandate? And so, which also means it's not part of their education, right? So that's not what they got, other than a few things like, they stick a, vital sign. That's why every time you go into an office, hopefully someone sticking a blood pressure cuff on you will get enough points now that to get it. How can we look at this from a business case to say, I need both health outcomes and I need business outcomes to justify changing anything. And they have to not be marginal, they have to be significant to cause me to go through the change. So maybe you can speak to the business side. You kind of alluded it to on that 15,000 per patient today.
Yeah, and by the way, just on that, 6% of our population, only 6% are in optimal cardiometabolic health. So it's a lot of us coming in there, right? I certainly don't sit in the 6%. So, it's something to track. On the business side, I mean, that to me is really where we have focused our efforts, right? Which is we know that this is not about, oh, clinicians saying, I don't want to deliver this type of care. They all want to deliver this type of care, right? This is the economics of I have limited time and resources. I don't have the technology to do it. Don't ask me to pay some money out for something that I don't even know if there's going to be a return for me. I've got so much stuff going on, right? I've got, that's what this comes down to. And so what we have really focused on is if you can work through the economics with that physician, right? And say to them, look, this is a collaboration. You do your job, empower and engage the patient in those 15 minutes. We'll do our job and lead them through this health journey with you longitudinally, and we'll deliver outcomes. And well, I've always said in the physician fee schedule today, there is value-based care. That sounds really weird. Everyone craps on the fee schedule, right? But or the fee for service model, I should say. But that's what we've designed is a model that says, hey, we can deliver this whole person care, right? Work on that patient's mental health and lifestyle as an extension of you, and there is reimbursable avenues for us to both be successful in. And so that's what we've been designing for 4 years. Look, we are operating within the current framework, so we've done the best we can, and we've really delivered with some of our health systems and our independent clinics creating this model. But we're literally at the doorstep of, I think, massive innovation that's coming. I mean, Scott, we're on the threshold of it because it's been released over the last 2 weeks. And that is, you know, CMS, right? The Center for Medicare and Medicaid Services, and their innovation program saying, hey, you know what we're going to do? We're going to make preventative medicine and lifestyle medicine, we're going to turn it on, right? And we're going to incentivize it and activate it in a way that it's going to really help. There's 33 million original Medicare patients in the system, beneficiaries. We're going to really turn it on and see if we can get into chronic disease remission and treatment and prevention at scale. And that's where we're on the precipice of that right now.
Yeah, and it kind of circles perfect. Thank you, because it circles back to where we started, at least alluded to. If we look at what are the treatments available for chronic disease, there will always be a place for traditional medicine. But what we're finding is it's not as effective of many of the basic lifestyle factors that people just aren't aware of, right? You talk to, and it's generally not, everyone says, well, what's the one thing I should do? No, there's probably two or three little things to do that just, or what you're doing already, you could do with a little bit more intention to find out that, well, you're already doing it. And if you did another, whatever it is, we'll say if you did I walk 3 times a week. Well, what if you walked, we'll say 5 times a week, because you do enjoy walking. And on a couple of those walks, what if you introduced like a hill or something, or you went out with a little bit more intention and walked a little bit faster, just to kind of challenge yourself? That's not a big lifestyle intervention, but I can guarantee for a lot of people, that would be a huge game changer, because it now starts to spur other things that you realize you start to see some response in metrics that we measure around health. but also from a freedom standpoint, you feel more empowered to do more things. And the more things you do, the more engaged you are also with other people in your community, right? Kind of get that isolation piece. There's a lot of reasons why people get isolated. It's never one thing. It's always a combination of things. So yeah, it's hard to believe. I talk about it in the context of transformation. When you talk to anybody who's had a transformation and like their energy is huge, and if you've never experienced it, it's got to be like, wow, I can't quite like I hear that person, but it's hard to connect. These become small transformations that I think are really identifiable for people if they just kind of lean in a little bit to some of these things.
Well, I mean, that's the big problem, right? With all these things we talked about, social media and advertisements and all that. It's that it feels like when you see someone transform, it's this, wow, they just, boom, it's there. And they had to put a lot of work into, of course, they had to put a lot of work and it happened overnight. But, you know, for the majority, I mean, that may exist for a small subset of people. They make massive transformation in a short period of time. But the reality is, I always say life happens and life is going on for a lot of people. And just like the issue with chronic disease, which is years of lack of literacy and years of lack of awareness and small little things that are deleterious to your physical health compound over the years, right? It's not like just one thing it's not like the one thing you ate drove your diabetes. It's the
Right.
many things you did over time. And I think that's the same application for change, which is you can do little things. And what will happen is those little things also have an effect, and then it gives you the ability to go to the next level, and ratchet it up, as opposed to feeling so overwhelmed. Like, where do I start? Sounds like I got to do like everything, and if I don't do everything, then forget it. It's nothing. And I think that's the sort of zero sum game that we have, that all of us have in health, in our health, which is, man, if we can't make these big transformations that we see, and it doesn't happen right away, it's either that or you know what, I got to settle in with the way I am, and I think we're showing that you don't have to do that.
Yeah, I don't know if I talked to you about my next book, but it ties into so many things you're talking about because it's all around the things you do every day, essentially the functional elements that are part of your life that you do probably without paying any attention to. But it goes right back to what you're talking about is this: how do you empower people with quality information that they can connect back to, again, where am I now and where am I going, to be able to see that and make it really readily available. Like as I was talking to doctors at the conference, and they were all kind of like, wow, like that's so obvious and got to be so appealing to people, right? Because people love information. Like we have this, people think older adults don't want information. No, they just want things that work well for them. They love information as long as it works. They're just a harder sell because they've got a lot more experience than the 20-year-old who will, it's new, then I want it. But ultimately, I think that's kind of coming back to what you mentioned earlier. This is such an exciting time, right? It's the Yeah, maybe it's been crap for, the last while leading up to this. Now it was a big driver, but at the same time, the technology had to be ready to step in. A number of things had to line up, and I think what you've really alluded to is the evidence is lining up. So, talk to me about what's going on in terms of clients that you got, because I know when I was at the conference, I met some organizations that you're working with that are clearly embracing your technology or your service. Really, I shouldn't say it's
Well,
just technology.
I think you find health systems, back to there's hope, right? We know, going back to your cancer patient, and their application of their health after their diagnosis.
Right?
I mean, to some extent, the health system is there, right? We're at the brink. We can't keep on going the way we are. It's gonna break the bank. We're not gonna provide services. So what's exciting is sometimes that trauma forces innovation and a lot of hope, and I think that's where we are. So what's really exciting is a lot of a lot of our partners have already invested in this. We've got, health systems that have actually deployed, think about this, teaching kitchens and health coaching services and, what I call even lifestyle medicine service lines, whole person care service lines. This isn't just like, oh, we've got our cardiology center, we've got our oncology center. They've got lifestyle medicine centers. So the health system itself is saying, you know what? We're investing in not just the reactive part, we're going to invest in the proactive part. And that, honestly, Scott, for many of your listeners who are patients or going through something, that's exciting that the hospital and the health system isn't just a place to go where you're sick. You can go to a place to figure out how to thrive, right? So that's number one. Two is those places are natural places for us to partner with because what we say is we just want to be your backbone, your infrastructure, complement what you're doing, expand, reach more people in the community. And so, yeah, from, Michigan to Florida to Texas to California, uh, you know, across the country, we found partners who are like-minded and are saying, we want to invest in these type of care pathways. We want to turn it on and give our patients this experience. We want to measure with you, Nudge, the health outcomes. And some of them are saying we're also going to track the cost savings. Does it improve, the ER visits go down, the inpatient admissions go down, all these little things that are costly to the system. So it's a really exciting time. It's an exciting time because I think there is innovate. Obviously, Nudge. I want to talk about Nudge, but let's talk about the fact that there's a lot of hope going on. These health systems, these practices are beginning to say, hey, we can actually turn the paradigm into a health span conversation versus how to prolong your yeah, your life and kind of manage through the disease, right? And that's where we are.
Yeah, the reality is, there's money in healthcare, which is always going to be the case. But I not met any doctor who would choose to send you to surgery if they had a better option available to them. And I think that's or a medication if they thought that you were interested in changing your diet or changing some other habits, that getting more sleep. If they knew how to talk to you about it, or they could put you in touch with somebody who could do it.
And how they get paid for it, right? I
Right,
mean,
right.
that's a big factor, and I think that is what is very, very exciting right now is that, you know, one of the largest payers, the largest payer is saying, we're gonna incentivize uh, clinicians across the country to start implementing whole person care, lifestyle medicine interventions to help their patients. And they're going to incentivize companies like Nudge to work with those providers to really amplify their care. So we are at a transformational time. I mean, we're weeks into it. I think 2026 is going to be a time when, don't get me wrong, we're talking about large numbers around healthcare, but I think the foundation for innovation like this, for longitudinal whole person care, really bringing, we talked about this need to really level up the literacy in our population around their health. That's going to happen. I think this is the year that's going to happen.
Yeah, I'm seeing it in because that's really my focus, is really around the literacy piece, and not that I get them young necessarily, but there's a hunger for it, right? And the more we kind of give them, the more they're starting to lean into it. So, um, but there's never been a system to deliver it nationally in the
Yeah.
past, and it's still a bit of a trial and error in terms of for all of us coming up through the system
And
as the public.
that trial and error. I mean, honestly, that's been the journey for 4 years. I've always said we've deployed this. It's exciting to see. It's exciting to see how we've taken even physicians who don't have a lot of time to talk about lifestyle medicine, but they know they want to put patients in the program, and we see what's happening. And you know, the opportunity now is to scale the infrastructure that we've
Well,
seen.
and the barrier traditionally has been is they were never trained in it. So now you're essentially freeing them. They don't have to get trained in it, right? That's again, that's a commitment to go do it. We see doctors doing that all the time, but the more efficient model for them is exactly what you're doing is say, we've got the team right here. You don't have to do anything other than give the referral or however that process works.
You nailed it. You nailed it. I mean, look, we just started off this conversation about Dallas and the American College of Lifestyle Medicine. So there's a legion of clinicians who know how to talk about this, right? And are gonna really get dialed in. There's still a large set of patients who meet their physicians and talk to their care teams that we want to be able to say, hey, you keep on doing what you're doing. We'll be the team to help you talk about that. Of course, you can, get more dialed in on it, but that is the model that we're talking about is how do we broadly address all of those patients that are not being seen by those clinicians.
Yeah, it's interesting as I'm thinking about it a little bit differently. Peter Attia likes to talk about medicine 3.0. And I've kind of been talking about it a little bit differently. It kind of goes back to that, like, what is the purpose of medicine in terms of as its primary guide is, and I think should always be reactive. So how do we bring in the preventive? That's what I've been trying to talk to people with for a few years is so how do we bring in preventive care when that's not their priority? Like, so are we just going to divide them up even further and you're now going to be, part-time surgeon and part-time, lifestyle coach? I don't think that's going to help anybody by dividing them up. We need some other way to bring preventive care in that's efficient and effective. And I think what you're doing is exactly the option we need to be exploiting. And I can see why it's going to grow so quickly.
Yeah, I always think of this as if we can lay the groundwork for every patient that has comes into the system and deliver and give them the fundamentals, the literacy, the awareness, but also the tools around their health, then all of us are benefiting because the more knowledge and the more application of that knowledge and the more they see the results, that's reducing the cost burden on the system. And I think I was talking to um, a senior physician leader who's been doing this for healthy aging for a while. And she was talking about the fact that, if you look at the Medicare population, the whole goal, 90% of Medicare beneficiaries will have one chronic condition, but the whole goal is can we get Medicare beneficiaries in the beginning when they're, 65 to that 75-year-old range. And because if you apply these interventions, you could, as I talked about, you can prevent, you can treat, and you
Right.
can pull disease back into remission. So imagine now, that's what the CMS experiment is really showing is can we get the right innovation to 33 million people, right? 33 million Medicare beneficiaries and start intervening and getting them educated and literate about their health so that it staves off larger issues down the road. And that's the grand experiment that CMS is putting out there now. And we want to show that that can work because then it's the downstream, right? Or I guess upstream, if you will. Um, you know, back to the conversation of I we were going 20, 30 years without understanding that like this stuff was going on with us. How do we get those folks educated about what's going on in their health?
Right. Yeah. And whatever doorway they come in, there's many doorways to come in to understand about lifestyle medicine. You might as well come in at the one that's of whatever need or interest. If so so let me kind of ask about how do people, or I guess it's potentially going to open up here pretty quickly, it sounds like with changes in CMS. So where's the where are the doors to Nudj Health to in terms of who is and who will be coming to your door kind of over the next 12 months?
Yeah, I think look, we talked about these innovative health partners that we've partnered with. If you are a patient, first of all, ask about whole person care, ask about lifestyle medicine, ask about the risk factors that are going on with your conditions. I would say that. Two, we love our whole thesis is let's partner with these primary care doctors, these specialists, these health systems. So hopefully we'll meet you there. But what CMS has essentially done though is if you are original Medicare beneficiary, they've now said, "Hey, we want to provide these type of nudge services to you direct, right? So you can reach out to us and connect, and we can work with your provider. We'd love to do that, right? If you want to bring this into your relationship with your physician, or we can just connect with you directly. So there's a range of things you could do, but we really believe that the journey with your clinician, your physician group, is a really exciting way to do this because they're working on all the other things that you're focused on your health.
Well, as you're saying there, one of the common things I hear is people don't have a physician, right? And they truly are operating blind. So I assume that's another gap you can probably at least
Yeah.
fill on the preventive side.
you know, direct them to the right physicians, maybe direct them
Yeah.
to this ACLM community. But even before that, I mean, that's kind of what CMS is saying is, hey, there's opportunities to bring coaching and lifestyle education to those patients. Let's get them now. We don't have time. The numbers are too big. The costs are too great, right? The impact of not touching and reaching folks is too immense, right? The opportunity cost is too big.
Yeah, we spend far too much time and money putting band-aids on things, right? There's only so many band-aids that you have to go around, and at some point there are holes in the dike. Like at some point you got to go back to get in front of it, and it's clearly how. Yuri, it's always fun to talk anything or with anybody around lifestyle medicine because if it's not obvious, the energy and the positivity and the optimism within lifestyle medicine, anyone in lifestyle medicine, boy, it's real because I think we're close to it. We see what's happening already. We've seen the change over the last 5 to 7 years of this is really starting to take off. And it's based on going back to that, it's based on real evidence and the outcomes that are both health and financial for those who get involved in quality of life. Ultimately, for a lot of us, that's what we're in the game for, whatever side of the coat we're on. So yeah, it's exciting to learn about what you're doing, and I'm looking forward to forecasting and of what's coming down the pipe here pretty quickly.
We've got so much, I mean, we've got so much innovation and technology roadmap deliverables and clinical programming deliverables and so much more that we could do. It's like I think of it as like educational uh, program. There's so much to do and build, but we see ourselves as I've always said we're a wedge company, right? We get in there, let's create a wedge, let's create an opening, show that this template can work, that we can deliver on outcomes, improve health, reduce costs, and then innovation can flood in. And I think obviously we just talked about everything what's happening in the last 2 weeks. The policy side is beginning to say we're going to take a handle of it and we're going to create the wedge in the opening. So very exciting time. And your listeners, they want to reach out and learn a little bit more about what are these things that affect my health. We're open to do that.
Awesome. Well, I'll put some links in the bottom of the show notes for you, and just I'm just so happy to have learned. Thanks for reaching out to me at the conference, and I learned a lot in that short conversation, and I'm glad it set us up to have this conversation today.
Well, I learned from you. I was following you, and the things you were writing about and saying were they were so poignant for me. And I was compelled to come, when I learned you were there, I was compelled to come find you. And I can see why you had this podcast and you have folks listening to you. There's a lot of really good purpose and intent here. So thank you.
Great. Well, thanks for taking time with us today, Yuri. Best of luck to you and your team. We didn't even talk about your team. Maybe just take a moment to talk about your team because it's really really special.
I mean, I'm here sitting with you. That's probably because you couldn't have the entire team here sitting with you, right? But I will say we had a one of the health systems we're partnering with, a physician who met our team and just said, they're motivating me, right? So there are a group of really caring, dedicated, gritty clinicians, team members, data managers, patient navigators, enrollers, technologists who are all just working every day on this singular thing. Can we design, right, prevention and lifestyle medicine within the system and really extend care from the normal way we've been doing it for the last, so many odd years. So there's a whole team that's doing it. So, and I'm the voice right now, but I represent them. So my hats are all, if they get to see this, it's for them.
Yeah, awesome. Well, thank you. Okay, sir, until next time, keep breaking down the walls and doing the good work.
Thank you, Scott. Have a good one.
Hope you enjoyed today's show. Great to have you part of our over 10,000 strong WhealthSpan community. Remember to subscribe if you'd like to learn about our upcoming shows. And as always, make sure you provide some feedback, whether that's a thumbs up or a comment, a question. They're all welcome. If you'd like to subscribe to our quarterly newsletter, you can do that at wealthspan.com. We're always looking for show ideas, or maybe you think you'd like to be a guest. Again, please reach out to book a motivational talk or inquire about our leadership workshops. Email me at info@wealthspan.com. Until next time, stay engaged, stay curious, and take good care of you and those in your care.